11. I will start today's news briefing with an update on the cases. As of this morning at 11 a.m., the St. Catharines General, the total number of cases since the outbreak declared is 41. There's no change from yesterday. The number of confirmed cases currently in patients at the site is 24. That is an increase of 2 from yesterday. The number of hospital-associated cases currently in the hospital is 13, and that is no change from yesterday. The number of community-acquired cases currently in hospital is 11, up 2 from yesterday. The Greater Niagara General site, the total number of cases since the outbreak declared is 14, no change from yesterday. The number of confirmed cases currently in patients at the site, 12, which is down 1 from yesterday. Hospital-associated cases currently in the hospital is 9, that is up 1 from yesterday. The number of community-acquired cases currently in the hospital is 3, that is down 2 from yesterday. At the Welland site, the total number of cases since the outbreak was declared is 12, which is the same as yesterday. The number of confirmed cases currently in patients at the site is 9, that is down 1 from yesterday. The number of hospital-associated cases currently in the hospital is 7, there's no change from yesterday. The number of community-acquired cases currently in the hospital are 2, and that is down 1 from yesterday. In discussing the deaths, we have had one additional death. A third patient related to the C. difficile outbreak at the Welland site died yesterday late afternoon. On behalf of the hospital, we want to extend our sincere condolences to the family and friends of this patient at this extremely sad time. I will not provide any details of this patient's condition due to confidentiality, but can tell you that this patient had serious underlying health issues and also tested positive for C. difficile. The death will be reviewed to determine what role C. difficile had or did not have in their death, and this death has also been reported to the coroner. At our smaller sites, we continue to have one hospital-acquired C. difficile case at the Niagara-on-the-Lake site. There continue to be 2 cases at the Douglas Memorial site. One is hospital-associated and one is community-acquired. At the Port Colborne site, there is 1 case, down 2 from yesterday. This case is a hospital-associated case. General comments. Management of the outbreaks continues to be our hospital's central priority. While our main concern is for the patients and families, we are also focused on our staff, physicians, and volunteers. As you can appreciate, this is a very difficult time for them. They are working as hard as they can to get us out of the outbreak and to continue to prevent us from further outbreaks. We are trying to focus internally and keep our staff from getting distracted by the politics of the situation. I do have one clarification from yesterday. In one of the Toronto broadcasters, it was reported that the Niagara Health System housekeeping staff are Aramark staff, and this is incorrect. All of Niagara Health System housekeeping staff are employees of the Niagara Health System. As I said yesterday, we have one person in a director position who is Aramark staff. All of our staff who are providing point-of-care housekeeping are Niagara Health System staff. Now onto the chronology of the events. I know I've covered off on the chronology of the events each day, but I would like to spend a few minutes on this again today because there still seems to be confusion with the public. It's extremely important that the public understands that it is safe now and always has been safe to come to any of our hospital sites. The public has never been put at risk. Anyone who needs medical attention at our sites should come for their care. Please let me emphasize again that C. difficile exists in hospitals and in the community everywhere. It is an ongoing challenge across the healthcare sector, as we're seeing from news reports of C. difficile outbreaks at hospitals in Guelph, Hamilton, and Toronto areas in recent days. We called the outbreak at the St. Catharines General site in conjunction with Niagara Region Public Health on May 28th. Prior to this, as the number of patients with C. difficile increased at the hospital site, we were in regular communication with Niagara Region Public Health. Numerous enhanced precautions were put into place, which included signage in public areas and on patient doors of patients who were in isolation. This is an everyday practice for the Niagara Health System and all other hospitals in the province. Signs are put on the door of any patient in isolation in order to protect visitors and families and those other people coming to the hospital. In Ontario, outbreaks are called based on a number of factors, including the number of new cases in hospital with C. difficile, historical activity level on a unit, control measures that are in place, an overall increased number of patients with C. difficile for 2 consecutive months compared to peer hospitals. It is a very rigorous statistical analysis. The outbreaks at Greater Niagara General Site and Welland Site were declared on June 23rd based on those reasons above. We always work closely with Niagara Region Public Health with respect to our infection prevention and control monitoring and surveillance, and they were involved in regular discussions with us prior to declaring the outbreaks. When we have patients with C. difficile in our hospital sites or any other infectious disease of any sort, precautions are always immediately put into place. These include, as I said, signage in public areas, on patient doors, isolation precautions, enhanced cleaning, dedicated equipment, etc. As soon as the outbreaks were declared, we moved to publicly report C. difficile related deaths that occurred. This is above and beyond the practice of other hospitals. It would be an infringement of our patients' and families' confidentiality and highly unusual for any hospital to report individual deaths directly to the public. Hospitals do report C. difficile rates to the Ministry of Health and publicly monthly. This occurs since the outbreak in 2008 at the Joseph Brant Hospital in Burlington. As Caroline mentioned earlier, our internal Chief of Staff, Dr. Joanna Hope, is not here today as she is currently at this moment meeting with families of our patients who have died in association with this outbreak. Once Dr. Hope has reached and met all of the families of the patients who have passed away, she will be in a position to report publicly the results of the reviews of the death. Around Hotel Dieu Shaver, we continue to be in daily contact with the team at Hotel Dieu Shaver. Today I spoke with Dr. Jessica Hopkins of the Niagara Region Public Health, and she has advised us that they are awaiting the results of the typing. This could take up to 8 weeks. In the meantime, we are offering our assistance to the Hotel Dieu Shaver to help them with their outbreak. Dr. Hopkins also told us yesterday that she does not have any concerns with the precautions that were taken when these patients were transferred from the NHS to Hotel Dieu Shaver. We regularly transfer patients between our hospitals based on their care needs, and Hotel Dieu Shaver is well prepared for any patient who requires isolation. That's my update.
Okay, so that's it for the update. Could I just